Hi guys, Dr. Tielemeier here. I want to tell you about my key takeaways from NCPA Annual Meeting 2016 and also to give you a few actionable tips to start working towards collaborative agreements and cultivating those collaborative relationships. So, the overall theme of NCPA 2016 was definitely enhanced clinical services. And we talked a lot, especially in all the sessions that I attended, about how independent community pharmacies can set themselves apart by offering these enhanced clinical services. Now, as a consultant pharmacist, I work with these independent community pharmacies in my area to help them add new clinical services, train their staff, run through these problems and barriers, and create really sustainable workflow oriented models for clinical services. So, the problem that I heard a lot of independent pharmacies and pharmacy owners say is they don't know how to start that conversation to foster and cultivate the pharmacist provider relationship. So, one speaker at one of the discussions gave a really great tip, which is to contact the providers that are sending you a lot of patients, especially patients that are looking for over the counter items, and to tell them that you want to work with them and their patients to create a customized over the counter package. So, the example they gave was working with a dermatologist that prescribes a lot of over the counter items, that you would create a customized package for their patients and for them, so that when the patient comes into the pharmacy, all they have to do is say, where's Dr. So and so's over the counter items? And you would just point them directly to their over the counter little area set up. This would work with GI doctors. There's lots of other doctors that I can think of that would work well for creating this type of customized over the counter package. The number 2 tip that I will give is to really understand what the providers are dealing with, what their challenges are, and what their barriers are. Now, if you don't know, the best way to figure that out is to ask them. So, I really tried to educate myself and the members in the Pharmapreneur Academy on the changes in macro legislation, the CMS new bundled payment model where they're paying for patient outcomes and performance. Basically, with MIPS, the minimum incentive payment system, the providers are either going to be incentivized or penalized for their patient outcomes. Now, they are choosing which measures to be looked at and to provide data on so that they're being graded on, and each clinic could be a little bit different. So it's very important that you reach out to them, ask what their biggest challenges are, really try to educate yourself and understand what they're going to be dealing with in the new changes to the CMS legislation. And that's also going to have a trickle down effect, I feel, to a lot of the other insurance companies. So it's only CMS right now, but I think in the future there will definitely be other big players involved as well. So just imagine there's around 300,000 pharmacists in the US right now, totaling the physicians, APNs, and PAs. There's almost 1 million providers. So imagine if each pharmacist in the US just reached out to 2 to 3 providers in their area. What a huge difference it would make in helping enhance the profession of pharmacy. I really feel like we could do such great help to them and their patients. The third tip that I want to give is adding enhanced clinical services to your pharmacy will help prepare you more for provider status than anything else you can do. So a lot of the pharmacists I talk to say that they are not prepared for provider status in the business sense. I think, as far as clinical skills and knowledge, most of us feel like we can, provide great patient care. But I think it's fostering those relationships, marketing our service, putting policies and procedures in place to have a really streamlined, sustainable type of service. And that's where we get stuck. All that provider status would do is really alleviate the challenge of billing and make other providers and billing teams especially a little bit more comfortable with billing for pharmacist services, since it would be much more black and white. Now, there are ways to bill for pharmacist services right now. We talk about that a lot in lessons 7 and 8 in the e-course at the Academy. But I think the best thing that you can do is start putting your services in a plan in place right now, so that when we do get provider status, it will make such a huge difference in how quickly you can hit the ground running and take your services to market. So you'll already have created those collaborative relationships with the providers in your area, and it will make that process so much easier. I really feel that what we do as a profession in the next 5 years will go a long way to building what the next 20 years is going to look like for the profession. So, if you want a little bit more information, or if you want to stay up to date with the trends and everything that's going on in pharmacy today with enhanced clinical services, I welcome you to join our newsletter. It's at btpharmacyconsulting.com/newsletter. I usually send out emails about once a week, just about macro legislation and changes in the bundled payment model, anything you could want to know about pharmacy's enhanced clinical services and the changes that's going on there. So I tell my members that I really do a lot of the research, go to the conferences, read the white papers, watch the webinars, gather the information for them so that they can focus on building their businesses and building their enhanced clinical services, whether it's offering transitions of care management, chronic care management, annual wellness exams, or even MTM through physician incident to codes. So if you want more information, or if you'd like to contact me, again, I'm at btpharmacyconsulting.com/newsletter. Feel free to contact me anytime if you have any questions at all. Thanks, and have a great day.